So there's a psychologist, maybe you all have heard of him, Bob Knight. He's at USC, or at least he was at USC, and he's done a lot of work with doing therapy with older adults. And he says that basically you're going to do therapy the same as you would with any age group, except there are a couple factors that we need to keep in mind. One being that the cohort effect. Know what time in history your patient grew up and came from. We talked about that. That's important. And if you don't know, the patient can educate you to some degree. And that's going to change. The cohorts will change as the population grows older, and there's going to be probably an even bigger need for therapists who work with older patients as the baby boomer population gets older and they're more open to psychotherapy and mental health interventions. So he's has made a point of making people aware of that. And he also notes that you have to be able to be flexible as far as working in different settings, different environments like nursing homes, and there is some flexibility that's required as far as, like with the patients who I see, they sometimes end up in the hospital, and I try to go visit them in the hospital so that we can keep the continuity, and I feel that that's probably the time they need me most. So you have to be able to be flexible and get over there to see them and figure out how to get paid. But Medicare does pay now, starting since 1990. They started paying for psychological services, so hopefully that continues. So, and a couple other things, with the elderly population, you're going to deal with more health issues. So it's important to be somewhat aware of medical conditions and how that affects the person's well-being, and medications, and that mind-body connection is real important. What else? Also, in this stage of life, there's a lot of loss that occurs, so you need to be versed in dealing with grief and loss issues, which most therapists have that background. And and to be aware that that's something that will come up frequently in therapy. So anyway, what Bob Knight talks about in his book is doing the life review, and that's a big aspect of therapy with older clients, and reviewing the life that's been lived and where they are in the aging process, and how to help them construct their concept of self, which may involve grieving their losses. Or another example we talked about losing friends, maybe losing a spouse, and for like an elderly man who comes to mind for me, who was married for 30 years and now he's on his own, and how does he experience himself? And now he's happy to be a bachelor, but he wants a girlfriend, and that's hard sometimes to find when you're 83. Okay. There's all kinds of research on the positive effects of having relationships. And one research I'll just review real quickly. And this was a MacArthur study of patients in a nursing home. The task was for them to perform a jigsaw puzzle, and there were 3 groups. The first group received verbal encouragement while doing the puzzle. The second group were told how to do the puzzle, and the third group was the control group, and they got no kind of support, no social support. They were just told to, do the activity. And the outcome was the group that received the encouragement did better in the performance of the puzzle. The second group, who were told how to do the puzzle, actually did the worst. They did worse than the control group. So, social support improves performance only if it promotes self-confidence And we need to be careful that we're not too quick to show the person what to do, because that will decrease their confidence and instill hopelessness. Right. Okay, so positive function of relationships. They promote recovery from illnesses, and there's research that suggests that. There's a strong relationship between lower risk of dying of an MI. Studies have shown that. Death rates are higher in those who are isolated. And then I talked about mirror neurons. So why relationships or connections, connectedness to another person is so important for humans. So yeah, this is a really strong factor, you know, I think, the social connectedness. Men are less connected, but women's connections may cause more stress and conflict. So it may turn into a burden. So it's the quality, not the number of relationships. And this issue with pets and elderly or anyone, companionship, but people who are isolated, I've seen some really remarkable progress in a patient who was depressed who had a pet. So pets can help with spontaneous expression of emotions. So it increases socialization, it reduces isolation, and it also can increase physical activity. You know, throwing the ball. This is a woman who I see who has that dog is so cute, but it's, yeah, Bailey. And so she goes out and throws the ball for the dog, and she just loves that dog. I mean, she's really, if that dog isn't around, she's very depressed. But the dog got so attached to her, and the owner of the board and care was away for a couple weeks, and the dog started nipping at visitors, because it was, I think, we figure, you know, trying to protect her, and so that caused a bit of a problem. Now she's not very happy when the dog doesn't come.